The Alumni Association of the University College Hospital, Ibadan, is making concerted efforts to establish a cancer diagnostic center as its contribution not only to the upliftment of the alma mater, but also as a way of finding a solution to Nigeria's worsening cancer profile. The association needs about 2 billion naira to achieve this. Cancer is one of the leading causes of death in Nigeria. Owing to lack of diagnostic equipment, many Nigerians die even for reasons that could have been avoided. The UI Alumni Association says that if and when this project is realized, it will help in checkmating medical tourism, in addition to preserving scarce foreign exchange in the process. Well, to give much-needed oxygen to a clarion call for help in this respect, we have here with us now Professor Elsie Adewoye, President, University of Ibadan Alumni Association Worldwide, and Professor Otegbayo Abiodun, who is the Chief Medical Director, University College Hospital, University of Ibadan. Good morning, Prof. Good to have you join us.
Thank you. Good morning.
Good morning. Well, you're looking for 2 billion, isn't it?
Yes.
Tell us about this project. Everybody knows that, yes, cancer is big, is major in terms of, what ails our people. Close to 1 million people, we're told, die almost annually. And that's that's almost like 10% of the total number of people that die worldwide. About 10 million, we're told, annually. What inspired this move, and how far have you gone in trying to raise this money to have the Diagnostic Center?
Thank you very much for bringing us to the platform. University of Ibadan Alumni Association noted that gap. It's like a vacuum that has been seen, that if cancer is diagnosed early, treatment will be easier, and then the number of deaths will be due to cancer will be reduced. So University of Ibadan Alumni Association noted that gap, and then we launched out to create awareness so that people will know, and then we can later approach good-spirited people, corporate organizations, to donate towards the need for creating the diagnostic center or unit of the cancer treatment department. University of Ibadan Alumni Association doesn't have the money. No. UI alumni is a congregation of graduates of University of Ibadan. So it's not that we have pumped money somewhere that we want to use. No. We want to go all out, asking for help to fill this gap. Right. That's the project.
It's a very noble, movement, would put it that way. But let's bring Professor Otegbayo into this conversation. When we talk about the diagnostic equipment that we have, the shortage or almost lack of it in the country, what do we know in terms of the wider picture and accessibility to the equipment?
Well, thank you very much. And I must also thank Professor Adewoye for bringing me in. This initiative, I must say, is that of the Alumni Association of the University of Ibadan. I'm actually here as Chief Medical Director to lend credence to whatever she is going to say, not to be a principal actor in the conversation. However, having said that, there's a huge gap in what we need and what we have concerning diagnostic equipment. Not just diagnostic, there are 2 arms to cancers. There's the diagnosis arm and there's the therapy or the treatment arm. But what the University of Alumni Association intends to focus on at this point in time is diagnostic. There are a lot of equipment that are needed, and they are very, very expensive. And these are not sufficient all over the country, and not just for us. There are some scattered all over, but the effort that the Alumni Association is making will boost the effectiveness of diagnosis and therefore early treatment and effectiveness of treatment of cancers. That is what I would like to say at this point in time. Thank you.
Okay, let me stay with you, Prof. What do we have now? How, in terms of equipment and in terms of practice, the cancer unit of the UCH. How is it functioning? What are the statistics? And why do you, of course, you will always need better facilities, but then where are we at the moment? Because UCH is a federal government property, and you are number one in the country. Where are you in terms of your ability to deliver service as far as cancer treatment and diagnosis is concerned in Nigeria?
Yeah, for the diagnostics of cancer, some of the equipment required are like the magnetic resonance imaging machine, the computer tomographic scan equipment. We also need other things that are used in nuclear medicine that can scan the whole body using radioactivity. We have the SPECT. We also have the PET. PET is positron emission tomography machine, and SPECT is single photon emission tomography machine. The last two I mentioned we do not have at all. That's the PET and the SPECT. The CT scan that we have is what we call the 8-slice CT scan, which is also on a PPP basis, that is public-private partnership. It would be a good idea to have our own. And of course, the magnetic resonance imaging machine we also have is also on PPP. And like I said, for the CT scan, it will also be a good idea for us to have our own MRI machines, because we don't just use these machines for diagnosis, we also use for training. UCH is a foremost training for medical specialists in the West African sub-region. And all these machines are required. And of course, for a big center like our own, you don't just want to have one machine, because one may break down. What happens in the interim where you are fixing it? So there are always supposed to be backup for critical equipment. And of course, ultrasound machines, things have advanced now. We have 3D, even 4D ultrasound scan machines now with some probes that are very, very sensitive in terms of detection of cancers in the early stages. These are things that we want to do to boost. Of course, for breast cancers in particular, there's also a machine called the mammographic machines. Federal government has approved money for us to procure some of these, and government is doing a lot. Okay. But the intervention of the private sector or the public will also be a welcome idea to boost what the government has already provided.
All right. It sounds very capital intensive, I would expect, with the state-of-the-art equipment, which I would expect you want to do it very well. So 2 billion naira. Prof. Adewoye, could you let us know where we are in terms of raising this capital for the center so far, and what kinds of profiles are you trying to attract? How do people get to be a part of this?
So far, we're still at the stage of creating awareness to the public, so that when we approach different organizations, they would have heard about the program or the project, what we intend to do. It won't be news anymore. And that's the stage we are now. We are trying to reach the Ministry of Health for whatever assistance could be gotten from them. And then we move. If the Ministry of Health identifies or stamps our project, then we can move out confidently to corporate organizations home and abroad to raise money to fill up those gaps.
So how do we, if I were interested, how do I go about contributing to it?
Okay, we have an account where people could pay into and labeled as, what do you call it, cancer diagnostic project.
It's dedicated to this project?
Yes, the University of Ibadan Alumni Association, yes, will do that, and then people will just pay into it, which will be used to fill up the gap at UCH.
But Prof, 2 billion naira is...
It's a lot of money.
Well, it's less than $4 million.
Okay.
And I'm wondering, yes, it's a lot of money, but then given the type of figures that we had during COVID in 2020 and 2021, almost every state, we were told, got at least 1 billion naira. I'm saying that Nigerians would say that only 2 billion is what is required. Whereas in 2020-2021, so much money was pumped into prevention, into upgrading hospitals, into doing different things for COVID. However, I mean, whereas for cancer that everybody knows is a major, it probably, kills more people, affects it, why does it look like it would take the intervention of an alumni association as yours, to come up with this idea and not something that a government ordinarily ought to have, thought about?
Thank you. I think the government is doing a lot. The government is doing, just like the Chief Medical Director has said, they have some things, some money are being pumped into UCH. Let me talk about UCH. Some money are being pumped into it. But just like we have identified the vacuum, it means the government cannot do it all. We still have some. And then I just assume, well, UCH is not the only government
medical facility.
Yes, medical facility where they have to pour money into. So I believe it's going to be shared by the government. But what happens to the remaining? And that's why we feel as an association, as a body, where can we fit in to ensure that such services are readily available for the masses and those who cannot travel abroad to treat themselves.
But what informed the choice of cancer? Have you done something similar like this before? Have you made interventions regarding, say, malaria, say, tuberculosis, say, other diseases that are ailing our people? Why cancer?
Yes, the issue of cancer came up because it's like the highest thing killing a lot of people. I wonder whether there's any family who has not had the issue of cancer on one person or the other. It comes up and it kills. Why can't we arrest? It just came up. This is something that is destroying people. And we seem not to be able to arrest it or reduce the trend. And that's why it came up. Just like Alumni Association, we identify a vacuum or problem in university setting. And then we take a decision by the council to intervene, depending on how whether we can do it or not.
Okay, so you're at the awareness raising stage right now. Could you give us an indication, is this something that there's a time frame around? When are you looking to have, accumulated those funds? Is there a projected amount of time? And more importantly, what is the response level been like from the targeted parties?
The awareness program is still going on. But we don't want to wait until after awareness, then we start to do. We want to write to corporate organizations, some individuals. At the same time, if opportunity to create more awareness comes, we seize that opportunity. While we also address some individuals or corporate organizations.
Yeah, this facility.
So the thing will be going pari passu.
Pari passu. Okay. So the proposed facility will be located within UCH?
Yeah.
Is that correct?
UCH.
So the 2 billion will take care of the actual building and the equipment that will be required?
It will take care of some of the things specified, the equipment and any other thing needed there. Maybe there's, what do you call it, training manpower to man some specific machines, to buy those machines, and which the department, the head of department, will be able to highlight, because he's directly in charge and he will know where we should put our priorities.
Professor Otegbayo, in terms of personnel and manpower within UCH, talk us through how good we are and the level of confidence that people have in their interventions, in treatment. We know, of course, that the percentage of mortality is maybe a bit high, but in terms of the manpower that we have, is it something that Nigerians can boast of, or have we lost a good chunk to brain drain?
Thank you very much. I would say that Nigerian doctors generally are rated to be among the best in the world. And at the University College Hospital Ibadan, we can beat our chest to say we have the manpower to give effective therapeutic interventions and diagnostic interventions in terms of care of cancer patients. Like you rightly observed, we have lost some health workers to brain drain, but I believe the federal government is making an effort for replacement. But when it comes to the ability to handle the situation in terms of diagnosis and treatment, University College Hospital is well able to do so. And we have a lot of confidence in our experts who are oncologists in various areas.
After diagnosis,
what is really the problem a number of times is inability of the patients themselves to even afford the care. Because just a few patients are on health insurance. People who are sick, who have cancers, have to pay out of pocket. So even when the experts are there, the equipment is there, the ability to pay is often a problem. However, recently an organization came up trying to help cancer patients by paying, or at least giving like 1 million naira to each cancer patient that is verified to be indigent. So that is what is currently going on.
Chemotherapy is an integral part of the treatment, I believe.
Very well. There are about 4 aspects of cancer treatment. It may be surgical, in which case you can do surgery to remove it. It may be radiotherapy, where you use ionizing radiation to kill the cancer. And it may be chemotherapy, where you use chemicals or drugs. And the last one for the advanced cases, where nothing can really be done, just to make passage peaceful. You use what we call palliative care. And we have all these levels of care at the University College Hospital.
Okay, we understand, Prof, that the Cancer Fund currently has the support of the immediate past Minister of Health, Professor Isaac Adewole as well. How much work has been done in that regard in terms of galvanizing even the current administration in the health space, in the Ministry of Health space, to garner some more support for this cause? And, of course, speeding the entire process, I would assume.
With the past Minister of Health. Yeah, the past minister, incidentally, is, or fortunately for us, is still a staff of the University of Ibadan.
He returned to the university after he served. No, I'm just asking.
He did. So he's been very supportive, and he's given us suggestions on what to do. So he's supportive.
That should be an advantage because
yes,
somebody from UI, he was vice chancellor, wasn't he?
Yeah, he was vice chancellor.
Exactly,
and then he became minister.
He became the minister of health.
Yeah.
And then he returned to the institution.
Because he's not retired.
He's not retired. That's correct.
And he must love the institution. That speaks volumes.
Yeah. Absolutely. He's been extremely helpful.
Abi asked about timelines. I know that this is not something that you can control, but what do you desire? What sort of timelines would you like to work with in terms of, after the processes of awareness and then fundraising and then the actual intervention? Are we looking at this year, in particular, or we're just starting off this year and hoping that by 2023 you finish off? What are your expectations?
We hope that we're starting off this year and then we hope latest end of the year or early next year, we'll be able to fill up the gap. As much as we have assistance from people, once all the specific things or the gaps are being filled, we are done.
And the center itself, how long would we project or imagine it will take to actually
maybe
put
6
together?
months.
Okay, because that will, of course, people, once it's come together, people will look forward to it. So.
Maybe within 6 months.
Okay.
With money on ground, it can be delivered within.
Sure.
Oh.
I'm sure Prof may be able to say something about it. Well, if there's money there, how long does it take to bring in the equipment or whatever we need?
And set them up.
Yeah, procuring the equipment and setting them up doesn't take much time. What the determining factor is whether you have the cash. And some of them are already available that can be delivered within a matter of 2-3 weeks. In fact, most of them. Even though there are some medical equipment that have to be manufactured from the scratch but the ones that we have listed here are such that you can't pick it up in the shop, so to speak.
I know that as medical expert, your main areas are the diagnostic part and then the treatment. But these days, a lot of people hear so much about the things that are needed to prevent even cancer. In terms of healthy living, in terms of diet. Is that part of the holistic
approach?
Treatment that you think that the information needs to go out to people, not just to wait until they get cancer and then they are rushing. Many people can afford it. Whereas, is it preventable? That's my question.
Very, very preventable. In fact, there are some cancers that are 100% preventable. In my own area of specialization as a gastroenterologist and hepatologist, there are some viruses that have been associated with causation of cancers. For instance, most of the time, the cause of liver cancer is hepatitis B virus. And a vaccine has been available since 1981 and is over 99.something% preventive. So if you take immunization for such a virus, it means you are likely to be sure that you will not.
Hepatitis B virus.
Exactly. So there are some like that. And of course, there are some lifestyles. Like they said, we are what we eat. At certain age, there are certain things we should not be taking. There are certain things we should increase in taking. So if we keep all this in mind, and of course they say life begins at 40, but that doesn't mean you are starting life afresh. It just means that that's the stage when many ugly things start rearing their heads, cancers become more common, back pain, arthritis, and all those things. So it's like showing you life. So what many people don't do is to do health check. When you reach that age, you are supposed to do at least once in a year medical checks. Comprehensive, not just do blood tests, and you have to subject yourself to a doctor who will examine you physically and recommend some tests that you need to do to be sure that your systems are functioning very well. And like she said,
40.
Yes, from age 40, yes. And when these cancers even start, if they are detected early, they are easier, cheaper, and more effectively cured than when it has become advanced. Like I said about the 4 types of treatment, when it gets to what we call stage 4 in oncology, that means anywhere in the world there's nothing anybody can do other than to give strong analgesics to make sure that passage is peaceful, there's no pain. So this lifestyle modification, which include diet, exercise, screening, that is medical checks, will go a long way in preventing. And of course, our public health departments and public health nurses have preventive aspect for all diseases. At the University College Hospital, when the patients are gathered in the morning before they see their doctors, our public health nurses attend to them first. They give them a talk, they pick a particular disease that is common or even disease in that particular department and talk about it. We even have audio visuals also for them to see how prevention can be effective.
I like that Steve asked this question because the things I'm just hearing for the first time, which leads me to wonder about public sensitization around this. It's a good thing UCH is doing that, but how many other institutions are doing it? For the, do I have to go see a doctor first to even ask him, hey, from 40, how do I start to live my life? Or that's already being fed to me subconsciously over time. What do we know about sensitization programs around the scourge of cancer?
Well, WHO has different days for different diseases, especially the ones that are known to cause high mortalities. And in our own environment, at least from our statistics from the University College Hospital Ibadan, 3 major diseases are the killers in our environment. And these are cardiovascular, that is heart and heart-related diseases, The second one is infections, and the third is cancer. Sometimes cancer comes second, and it's increasing. In fact, from the statistics of UICC, International Union Against Cancer, that is in Switzerland, the cancer rates in our population, especially in sub-Saharan Africa, is going to double by the year 2030. But that is if we don't do anything about it. These are statistics, statistical projections. But if we step up preventive measures, like we are saying, that may not happen. But if we don't do anything about it, it may happen. And that is why what the president of our Alumni Association is doing will be a huge help and leap forward in trying to prevent that kind of thing. People can readily come, especially if the test can be subsidized or included in the national health insurance screen for people to come forward and do their screening. I think other organizations are also available, like NGOs, who are in some specific areas of diseases. There are some cancers they talk about, like cervical cancer, breast cancer. I'm aware of some organizations that are taking that up. But I believe a lot still needs to be done along these lines to make sure that it gets to the local people. Most of the time, these things are concentrated in the cities. And for those who are educated the Western way, in the rural, and of course we know that about 70% of Nigerians live in rural areas, but many of this information doesn't reach them. And if our primary healthcare system, like it is now, works better, preventive aspect is even more. Is supposed to be more at that level before anything gets to the higher hierarchies of healthcare, like secondary and tertiary.
All right, Prof, I like the fact that you touched on the lifestyle modification aspect of it, and the need to for people to adjust, especially when they start reaching age 40. And you said that you are what you eat. So I wanted to ask if you could expand, the knowledge there. Are you also what you drink?
I want to smoke.
What you smoke?
Asking for a lot of Nigerians here, in terms of, does anything lead to cancer in terms of what you drink, or you are just basically dealing with the issues of liver and kidney?
No. Not just liver and kidneys. Generally speaking, there are some things you consume. Let me just don't say food, what you consume. If you smoke tobacco, for instance, tobacco by the World Health Organization is classified as type 1 carcinogen, meaning that it is something that is definitely associated with cancer. And that is why in developed countries, you can't sell a tobacco to a minor, and you cannot buy it without seeing a label that this thing can kill you. So if you do it, it means you are ready to die as a result of it. So lung cancer is strongly associated with that. Alcohol is also known to be associated with various cancers, especially cancers of the colon, of the stomach, of the esophagus, that is the gullet. So with some other things. And of course, there are some substances that are in the food we eat. They are generally called carcinogens, like granite, for instance, or gari that is stale, and the food that is stale. I remember in those days in the village, you see mold on food. People would just use their hand to scratch it away, and they eat it. Some of those things contain what is called aflatoxins. Aflatoxin is also a known carcinogen that causes cancers. So if we are able to prevent consuming many of these things, we are in the right way. And of course, fatty foods are also known to be associated with cancer. Then the way we are in Nigeria, or maybe in Yoruba land, when you are big, they see it as a sign of good. Obesity itself is a risk factor for cancers. That you are obese is a risk factor for cancer itself. So that's why we're talking about lifestyle modification. We eat the right diet and we exercise. This stimulates our immune system. And the body itself has some protective mechanism. They call it the surveillance system. There are some cells that go around looking for abnormal cells that may become cancerous and mop it up. When your immunity is low, that becomes dysfunctional and is unable to arrest the cells that are trying to go cancerous, and they fetter and become cancerous. So all these things are what we can put in place as lifestyle modification. And all this, when put in place, will definitely prevent some cancers.
This is why the sensitization needs to happen.
And also immunization.
Immunization.
Cancers, like I said, like hepatitis B. For cervical cancer now, there's a human papilloma virus has been associated with it. And there's a vaccine for that for children from 15 years and above. They can take it.
Is there a vaccine for the alcohol-related cancer too?
No.
Okay,
well, we know what the vaccine is for that one.
It means you want to continue drinking?
No, not me. I'm asking for Nigeria.
He's asking for a few people.
Prof, we want to thank you so much for joining us this morning, and we wish you, the best of luck in raising this necessary 2 billion naira towards this very noble good cause. We wish you all the best.
Thank you very much.